Cancer Council would like to acknowledge the traditional custodians of the land in which we live and work and pay our respects to elders past, present and emerging. Welcome everybody. My name is Katie Towers and I am the Survivorship Lead at Cancer Council New South Wales. Tonight we will be talking all about survivorship in young adulthood. So that's the years between 25 and 40. This will include real life stories from people who have experienced exactly this and are now in the survivorship phase, also any challenges that are commonly faced, but also strategies from our health professionals and from our survivor on how to strive forward post-cancer treatment. Just want to remind you that this webinar is being recorded. Everyone who has registered, you will be sent a link at the end of the recording. So don't worry if you get distracted by that chat box. You can always watch it later on when we send it through. So let's get started. Firstly, I'd like to introduce our panel. We have Gab, Megan and Ursula, who have very generously taken time out of their evening to take part in the webinar. So thank you very much for that. We also have our lovely Laura, who is on the chat box tonight. So please say hi to Laura. We will have time at the end of the presentation to go through some of the questions that you sent through in the registration. And if any questions come through the chat box, we can tackle them at the end of each presentation as well. But if you do have any medically specific questions, it's probably best to talk to your healthcare professional about them. If at any stage you feel like you would like to speak to someone urgently, please don't hesitate to call a lifeline counsellor on 13 11 14. They are available 24/7. So I'm just going to talk you through some of the icons that are at the top of your screen that you see there. In the green, you'll see the slides, so you are able to move forward and see what slides are coming up. You've also got the chat box, so that's where you'll be able to talk to Laura and send through some questions. It will appear as a pop-up as well. Chat to each other, support each other, tell us what's working, what you're thinking, what you think you can relate to or not even, and was the information even useful to you? And would you actually do any of the things that we've mentioned or have any additional things that you think might help others? We have put together a resource sheet. This sheet is sent out post the webinar, but you can have a look and see what the resources are that we've put together for tonight's webinar. And also in the yellow, we've got a survey there, but before you log off, you'll be directed at the end of the webinar to the survey. It should only take about 5 minutes to complete. If you do fill out the survey, we very much appreciate your feedback. Notifications are in red. So this is if, you know, good old technology, if anything were to happen and we need to alert you to something, the notifications will come up in the red bit there. My favourite feature is the map. So this shows you where across the world people are tuning in tonight. And you would be surprised at all the different places that we get to people viewing the webinar. So check out the map whenever you can. You've also got the help information, and that will give you the 1-800 number if you're having any technical issues, sound problems. You can just call a phone number and it will direct you straight through to the webinar. So you can pop in there as well. All right, so I'm just going to start off with Gab Asprey, who is a cancer support consultant and counsellor at Cancer Council New South Wales. So I'll hand it over to you, Gab.
And thank you, Katie, and hello, everybody. So I've called my presentation Line Interrupted. It's because people in their 20s, 30s and early 40s are often in the midst of their career, perhaps starting a family. You're fit, active, maybe involved in a sporting club. You could be gaining independence from your family of origin and really becoming you, creating your identity. I'm going to be running through some of the themes that come from our Cancer Council online community, through our peer support 101 and group programs, the Reclaim Life program that we're running, and our counselling service. Briefly touch on diagnosis, treatment and finishing treatment, but the main focus really will be about the reality of survivorship. There are so many aspects to being a cancer survivor, and some may resonate with you, but others won't. And I'm going to mention some difficult thoughts and emotions that will occur, and also want to mention the good that can come from this experience. I'd like to acknowledge that I'm using some images from a website called Upsplash to illustrate some of these things, and also using some posts from an Instagram account called At the Cancer Patient. So sometimes a cancer diagnosis may take quite a while to be made because you're too young to have cancer. And this can be a difficult thing for others to understand. Often, it can set you apart from your peers and may disconnect you from who you are or who you are becoming. Perhaps you end up being the first person in the treatment centre. It can make it difficult to relate to others, and this may further imprint the idea that you're different or unusual or on your own. Can I just check with you where I'm up to with my slides, because I think there might be a slight delay.
It's on the TikTok slide.
The at cancer page. Oh yeah, the TikTok. Okay. Okay, finishing treatment can bring mixed feelings. Others might be celebrating, but you aren't necessarily. Though there may be a place for celebration, there can also be a sense of abandonment, worry that you're on your own, or that you've got to get on with your life. So are the waves and the tumult heading towards you, or have you left them behind? And this is representing the uncertainty about which way to head. And what happens when treatment is finished? I think hopefully there's some optimism and relief. Come back. Part of the new normal might be learning how much attention and when to pay attention to fear of recurrence, reviewing what's important in your life, and maybe you decide to let go of those annoying things that are more concern. You've decided to not sweat the small stuff. Has that changed to the next slide, Katie? Not yet?
Should be there now.
Yeah?
Yep.
Okay, your sense of invincibility has gone. I have lost the innocence of assuming I'm going to grow old. Very powerful words. This could lead to a reflection on who you are and who you want to be. The purpose or meaning of your life can become a focus of exploration. You might ask, what is your new future? Can I turn this experience into an opportunity to head elsewhere and do something more meaningful? You might decide to review values and priorities. To help with this process, you may need to grieve the loss of the future that you imagined and the person that you were. Okay, can you tell me where we're at, because my slides aren't moving?
We're up to the when you see a food and drink.
Okay, good. Well, what this is about is early survivorship can come with some really unexpected triggers and reminders. So food, smells, perhaps visiting somebody in hospital can all play a part in this. Physical differences that you see in yourself every day, such as scarring, or maybe your hair has grown back different, and perhaps your fertility changed. And coping with these triggers can be really, really difficult. Next, just nod at me, Katie, if it's moved on, because nothing's moving at this end. Thank you. So this is about scanxiety. It really does cause fear, distress, and anxiety. And the question is, how do you pose yourself with all this going on? You ride with it, a bit like I am with my slides. Good. Yeah, thank you. You may have changed, but others haven't necessarily changed. You may lose mates that you thought were really solid. Forming new relationships also throws up challenges. For example, there can be uncertainty about how much you tell people about your experience, or you might be unsure whether to tell them at all that you've had cancer. However, those people that are there for you or who try and understand, they're the ones that are worth having around. So what is on the surface versus what's underneath? This is pertinent in different situations, and particularly when returning to work or study, to know what to say to whom. How do you explain the time away? You may decide to reevaluate your career or study, and that's okay. Validation of your experience is a key element of understanding people. I'd underestimate the value of connection through support groups, other media, the country, or community. They're the places where you'll get empathy from people who truly understand. You may feel relief from meeting other young adults who had cancer, giving you that sense of belonging again. Talk openly about the experience and what it's meant can be of enormous value. And having cancer can be a gift. It can be a gift because it's taught you more about yourself, about your values and your purpose. You can give the gift of understanding to others by sharing your story and opening up about the reality of survivorship. And you have to reevaluate what's important and find a different, more meaningful purpose. Don't be afraid to seek help to do this. Thank you. And over to Megan.
Thank you, Gab. Really appreciate that. And just in case you didn't notice, there has been a big storm tonight, so that's why there's been a bit of an in and out of technology. But again, if your internet does flag or anything or lag, please feel free to give that phone number a call, and that will get you through to the webinar as well. So I will hand over to Megan. Thank you.
Hi everyone, I'm Megan. I just want to start off by saying that a lot of what Gab had just mentioned really did just resonate with me, like all of it, all of the emotions. So I'm 28 and I'm a survivor of Hodgkin's lymphoma. When I was first asked to speak tonight, I was a bit, I guess, hesitant about it because I suppose I didn't think my story might have been significant enough or, relevant to the theme of tonight. And I then spoke to Katie, and I suppose I came to realise that the fact that I even just went through this in itself, and that I'm able to tell my story might help someone here tonight. So that's why I was happy to jump on and have a chat. So I'll start at the beginning. and I'll try and make it brief because, as Gab mentioned, when you are young, it does take a long time to get diagnosed. It was about 2 years leading into a diagnosis for me. So it started when I was backpacking in Southeast Asia. Towards the end of my trip, I actually became quite ill. I started to develop symptoms like rashes and lumps on my legs. I was getting really bad joint pain. I did the hospital tour of Vietnam, and then I finally cashed in my travel insurance, which, it actually comes in handy. And I got my business class flight home, first one ever. So I came home, saw my doctor, was told I'd need to see disease specialists, and it was kind of an ongoing thing. Eventually it settled down, and I kind of just got back to normal living. Those symptoms flared up again. I was admitted to emergency. I found out I had a condition called Erythema Nodosum, some random name, which is essentially an autoimmune thing. And so I was sent to a rheumatologist. And at that time, I'd started developing wheezy chest breathing problems. I was like, oh, great, I'm getting asthma now. In the end, the doctor actually referred me for a CT scan and of the chest area, and I actually came back that I had some inflamed lymph node tissue there. So that was consistent with an autoimmune condition called sarcoidosis. So essentially that began my long-term relationship with my rheumatologist, managed my symptoms day to day with oral and injectable immunosuppressant medication. And at the time I was also suffering severe IBS, so I was also seeing a dietitian on special diets and things like that. Little did I know where this was all kind of leading. So in July 2018, my liver function, this is a year later, I should say also, my liver function started to be highly abnormal. So we're just kind of watching that for a few months. It didn't really resolve. So I was sent to see a haematologist. And at this time, I was actually feeling pretty good. However, I did notice that I was starting to get a bit of itchiness on and off. I'd get pretty bad night sweats, and I was starting to lose weight, which at the time I thought that was attributed to this special diet I was on with seeing the dietitian. Anyway, so I went and saw the haematologist, more scans, decided to have a biopsy, and was all set to do that. And on the day of the biopsy, I was in hospital ready to go. And the doctor actually said, no, actually, we're not going to do this today because it was quite a risky procedure for someone my age. So put that off, and a couple of weeks later had a different type of biopsy that was a bit safer, and that kind of came back inconclusive. Again, more monitoring, waiting, watching. Another scan 3 months later, it had come back that lymph node tissue had actually grown. And that's when I was straight to the cardiothoracic surgeon to have a more invasive biopsy. A week later, had the review with the cardiothoracic surgeon. Mum and Dad actually came with me. They were like, oh, do you want us to actually come with your review? I mean, it had been almost 2 years now of me going to doctor's appointments every month. And they're like, oh, we'll just come just in case you need a bit of moral support. And when I got there, the doctor was like, so you've got classic Hodgkin's lymphoma. And my mum was like, oh, thank God. I don't think she realised at the time what it was, just because of the way the calm and conversational tone, the way the doctor said it. And I was kind of like, oh, yeah, thinking, oh, yeah, that's all good. And then when we kind of realised, we all just kind of froze up. And the doctor kind of just looked at me and he said, but you knew that, didn't you? And I said, yeah, because deep down I did. Just you kind of hope for the best. And it's just kind of weird how you do kind of know. Not once did he mention the word cancer. So again, he just kind of made it seem like, look, you've just been sick for a while now. You've just been getting the wrong treatment. Now we can get you into the right treatment. Just to help you get better. Luckily, I was able to see a new haematologist at that time, just because a little bit of faith was lost from my last doctor, just because it took so long to get to this diagnosis point. So moving on, I was able to start my treatment protocol. So I think if you wanted to change the slide, or did you want me to do that? Sorry. Cool, thanks. So essentially, saw the new doctor, found out I was actually stage 4, so it had been kind of brewing in there for a while. And essentially, I was actually eligible to partake in a German trial, which is a global trial for Hodgkin. And I was actually randomly allocated the trial drug, which is still just as effective as the standard drug that we have in Australia, but this was more looking at quality of life and how it can improve the side effects during and post-treatment. As you can see there, just on the screen, I've got my PET scan up. So you can see, I guess, if you look around my chest heart region, there's lots of tumours there. And obviously, the second one is post, all cleared up. So, I mean, look, it was quite a traumatic experience, I suppose, but it's pretty amazing what, medical science can do. And I'm just quite thankful that I live in a time where I'm able to receive that, where I was able to receive that kind of care. Luckily, despite my staging, because it was quite far along, I did have a small window to jump in and do a little bit of IVF, because obviously that was a concern, especially as a young female. I was 26 at the time. 27. I was coming into this stage in my life where I was starting to think about having kids in the next few years. When I was a little kid, I thought, having kids at 20 would be, you're so old then, that's when you're going to have kids. But obviously now that was later on, and I was, hoping to have kids by the time I was like 30. So, had to go through the IVF process. I do have a long-term partner, and it was a discussion we had to have whether we were going to fertilise the eggs and freeze them. And look, that's a big life-altering decision as well. And we essentially just decided to just freeze the eggs and not worry about all the other stuff, just because I was already kind of dealing with so many other life-altering decisions at the time. I ended up, it ended up being successful. Had a bit of a hiccup along the way. I had to kind of chop and change the hormones that I was taking, but essentially I was on 2 injections a day for 3 weeks. Before you go in for the procedure. They ended up working too well, so I developed, side effects from that with the hormones and everything. And around about this time, I was really starting to struggle to breathe, which we'd later found out that the tumours in my chest were finally they were growing more, and they were really pressing on my heart and my lungs. So I actually got admitted to hospital earlier than anticipated, and I was in there prior to starting treatment, which was a bit of a safety net for me, really. And basically just found out that nurses are just the most amazing people ever. They really helped me through it, and I ended up having my first round of chemo whilst I was in hospital. They kind of went through everything with me, all the things to expect and all the things that, people usually expect when you're going to have chemotherapy. But just little things, like letting me know I'm actually going to be, toxic. So when I'm at home, I need to do things like flush the toilet twice. Don't leave my toothbrush near other family members or my towel near them just because I was toxic. So just kind of all those kind of things, and, just avoiding staying away from sick people. So when I was the first administered chemo, I cried. It was overwhelming. And then once I settled down, I kind of realised it was a bit anticlimactic, and it was actually pretty boring, just waiting around all that time. When I got discharged after my first round, I actually felt really good. I was like, yeah, I've got this. I'm sweet. 2 days later, I was just like, oh, silly me. My blood had zeroed out. I couldn't walk. I couldn't eat. I couldn't breathe properly. I was exhausted. I remember having to get up to go to the toilet, and I just, after that, had to have like a 3-hour nap because it was just so exhausting. And then after that, after the first round, my hair started falling out, which the cancer nurses said was odd. Usually that happens after 2 or 3 rounds. But that being said, I was given the most aggressive type of chemotherapy because I am a young person and my body could take it, essentially. So basically I had a party of friends over for dinner, we shaved my head, and I basically just went bald the whole time. And that was kind of, one of the first of many barriers kind of going through the treatment. So obviously I've just, on the slide there, I've mentioned there's a delayed diagnosis and had to go through the fertility treatment. And, the fact that it was an aggressive treatment. Basically, the second time around with chemo, I did, I knew what to expect, but my mental health symptoms and my anxiety around it really did spike a lot. And, during this time, I started having issues with my swallowing. I couldn't swallow and I felt like I couldn't breathe, so much so that I made my parents take me to emergency. And so basically they all checked me out and just to make sure there was no tumours or anything in my neck obstructing, and it turned out it wasn't. I just actually had really, really bad anxiety. And I was admitted to hospital again, so I could see the psychiatrist. And that was probably one of the worst weeks of my life because of the mental state I was in and the steroid medication that you're given with the chemo. It actually really heightens your mood. So I felt like I'd drunken about 10 Red Bulls and I was just extremely irritable and manic. So they had to figure out what kind of medication to give me to calm me down. So that was probably one of my biggest barriers throughout treatment, and it's something that still affects me today, is I was really prepared for those physical side effects, the nausea, the fatigue, but it was just the mental things, that side of things that really shook me. So essentially, they gave me antidepressant medication, Valium. I started seeing a cancer psychologist, and we kind of discussed why my body was responding the way it did. And I started actually developing anxiety about getting anxiety because my first bout of it was so traumatic. However, fortunately for me, I was in full metabolic remission after 2 rounds, and I only needed to do 2 more after that instead of 4, which was really an awesome time in my life. So I kind of could see the light at the end of the tunnel, and mentally I started to manage better. So as I mentioned, medication, I did need it. I was in such a state where it did help. I didn't want to rely on that solely, but at that time, it was really all I could deal with. Other things I started to do when I physically was feeling up for it, things like walking my dog when I was able, downloading mindfulness apps, regular review with a psychologist. I started baking a lot, doing the washing with 6 people in my house. I come from a large family. Just doing things, basically to avoid just being in my own head. And I know this wasn't, the most healthy way to deal with things at the time, but it was all I could physically and mentally cope with at the time. And once I finished treatment, I actually went into technical menopause. So I remember sitting in front of the aircon a lot with my menopausal mother thinking, oh my God, is this what I've got to look forward to when I'm older? And thankfully, my menstrual cycle has come back on board. So, really positive things to come out of it. But I'm really glad I took the previous steps to help ensure that would be a possibility in the future. So I guess life continued now going on. Once treatment had ended, things changed and it didn't. It was kind of a bit of a surreal experience. So my mental health symptoms peaked again post-treatment because it was actually, survivor mode was over, and I had to kind of process everything that kind of happened really rapidly because I started treatment in August and was wrapped up by October. And at that time I was still experiencing severe breathing, anxiety-related problems. And this gradually eased by the end of the year. like I said before, I still get this every now and then, and it's usually when I'm really tired or stressed. I generally talk myself through that when that happens, and I just have to kind of tell myself it gets better, because it always does, and just have to acknowledge that there are good days and there are bad days. That meme right there resonated with me so much when it came out, just because I was super anxious and super stressed, and I became super obsessed with diffusing lavender oil. So, yeah, a big thing for me. I've also found, you know, now that I'm on the other side of things, I have, as Gab mentioned, less tolerance for things. Well, when I say less tolerance, things, petty things in life, you know, like overthinking things, or, you know, little petty arguments you might have with your siblings or even friends. And I've always been someone who wears their heart on their sleeve, so you always know what you get with me. But I think I sometimes come off as a little bit abrupt with people at times. However, I feel like I'm just being honest, and it's with good intentions. So I'm an allied health professional, so I work as an exercise physiologist. So I think, you know, what I've been through has definitely changed my approach as a treating practitioner with my clients, because I can empathise more and maybe tailor a more effective treatment plan for them. On the flip side of that, you kind of come across people sometimes who I think, in my personal opinion, can be a little bit dramatic about things, and I kind of have to step back and say, no, Megan, you know, pain is pain. Everyone experiences it differently. I guess I just kind of come from the point of view where I was when I was in the cancer centre and I was with other cancer patients and the hell that they were going through, and the struggles. Yeah, I just think sometimes people lack a bit of perspective sometimes with that. So that's something I take with me, and I try not to be bitter about that. I still get tired and very fatigued. And if I'm in a bad mood, people know it. So as I mentioned before, I just use essential oils daily. I drink chamomile tea obsessively daily because it helps me wind down. I enjoy going to the gym. I found that was and doing weight training. I found that was a really good way to get my anxious energy out, as well as build up my condition, because that was, you know, severely deconditioned during treatment. So I actually, you know, can't do that now, obviously, because of COVID, and I'm just in that higher risk category. But I try to get out and just exercise as much as possible, or walking, or just doing anything active. I always say yes to going out and doing things, because I felt like in the last 2 years I've had a lot of missed opportunities. So I'm always trying to say yes to things, and this is also pre-diagnosis and especially during treatment. So I'm lost where I'm at, sorry. Yeah, so I just try to get out and do things. And look, I'm a bit of a neat freak anyway, but that was really heightened during my treatment, and now that's just something I've carried through with me, which I suppose, considering with COVID, it's not really a bad thing. Like, it was no real big adjustment for me because I carried hand sanitizer with me everywhere I go. I guess overall I did experience quite a tough time, not only physically, which I think I bared that quite well, but mentally I really, really struggled. And like I said, I still experience moments of fear and anxiety, especially about having anxiety, as well as my mortality. That's a big thing. But however, sometimes I also just forget about it, and it's like a bad nightmare, a bad dream. And it's a bit surreal to describe unless you've kind of gone through it yourself. I guess I make it a point to let myself acknowledge that relapse and my mortality is a thing. I question it. However, I try to not let that consume me, my thoughts, because I just can't function day to day like that. And I just basically tell myself it's something I can't control, and I'll just cross that bridge when or if it ever comes. And I take things day by day. I'm always, like I said, trying to plan things, trips away, dinners with family, activities with friends. Having life to look forward to is what really is my big daily driver. And yeah, basically that's where I'm at now, surviving, living in a pandemic. And yeah, and I just wanted to thank you all for jumping in and listening to my story. I hope you could take something away from it, or not at all. Just listen to me rambling for a little bit. But thanks.
Thank you so much. And just on a personal note, I'm so thankful that you did agree to come along. Having your story and just explaining what you've been through just makes everything just so much more fruitful and enjoyable for everyone to hear. So thank you.
Thanks.
Next, we will be going over to Ursula. So thank you very much. I'll hand over the slides to you, but let me know if you need me to handle them. That's all
good. Thank you so much. And I hope everyone can hear me okay, whether you've got storms near you or not. Look, I'm so honoured and thrilled to have been invited to present today, and I always feel so humbled when I get to present together with people with, lived experiences and things like that, because I think that's actually what this is all about. And I also want to thank you, Megan, because you've made my job actually so easy, because I think everything that you have said has highlighted so many of the things that I wanted to mention. So I'm Ursula. I'm a clinical psychologist. I work with adolescents and young adults clinically in a therapeutic setting during and after cancer treatment as well, in the hospital setting, and I also have a research role at UNSW. And so what I wanted to touch on today was really kind of build you a bit of a picture of what I see as some of the most common challenges in survivorship for adolescents and young adults, and their loved ones, and start to help you think about some strategies to manage these. Now, I'm cognizant everyone is in a different place and everyone has different stuff on their plate. Some of you might already be seeing clinical psychologists and be well along that path. Others may not have ever thought about this. So, just take this as a little bit of a taster of some ideas, and you'll have a lot of thoughts and ideas of your own as well. But so I guess to frame this, building on everything that's been said so far tonight, it is not what you're expecting when you're a 25-year-old or a 35-year-old. It's not really what you're expecting in your life to get diagnosed with cancer. It's not in your life plan. And so it makes a lot of sense that it's a whole sort of 180 in terms of how you're thinking about your life. And I think, as Gab eloquently said, you kind of lose a bit of that imagined future that you had painted for yourself. And there's a huge sense of shock associated with that, sometimes a sense of grief. And I think that's where sometimes survivorship can be tricky. I think Megan kind of talked about this idea of being in survival mode, and I absolutely see that with all of the patients that I get to work with. And that's not a bad thing. I think we talk about denial as a bad thing, but I think that sometimes denial has its place in the sense of, when you're going through cancer treatment, it's sometimes easier for you to be kind of head down and just focused. What do I have to do to get through chemo? What do I got to do today? Just, keep on with it. And that can be helpful, during treatment. And then you come out the other side and find that actually that's not working so well for you anymore. So if there's one thing that I would take away from my presentation this evening, it's that you're going to find different strategies work differently for you at different times. And I think the key personally is actually just being flexible. So figuring out what works for you, different times, different days. So my passion has been survivorship for a while because, since I first got to start working with young people after cancer treatment, we realized it was this time of risk. And these are some quotes, from young people we worked with who said, I just didn't get much information about it. I was just told that I was finishing. I could get back to my old life. And you have this realization at the end because everyone's telling you, oh, it's all over, but you still feel terrible and you look terrible and you think, oh, this is bigger than I thought it was. So I think there can very much be this realization that the light at the end of the tunnel is actually just the beginning of the next phase of your journey, or however you want to think about it, which can be tricky. So one of the top issues that I actually wanted to pick out for tonight, and when I was thinking about what are the things that I talk to people about most commonly, one of the things that I reckon I often am having conversations about from a really practical perspective is just the lack of energy, the fatigue, and the chemo brain that can really persist for quite a while after cancer treatment. I think many people can be surprised actually how long that can stick around. And that's really tricky when you're a young person, previously maybe really fit, really active, really energetic. Maybe you're someone who used to go out on Thursday, Friday, Saturday nights, just really active and out there. And that can be really challenging to your self-esteem and your identity. One of the things that I often try and help people think about is also how that kind of energy or fatigue might also be linking in with your mood, because I think sometimes those connections can be useful ones to make. So one of the things that I talk about is this idea of the inactivity trap. And so it's this idea that, cancer gets you in this place where, you're not getting to do much stuff, you're missing out on a lot of stuff. And as a result of that time out and that treatment, you're sort of not very active, you're sort of feeling low, bored, feeling pretty average. And you come out of treatment as a result of that, you don't have much energy and you just don't have that much interest necessarily to get back into things. And so you're not doing things, you're not doing as many of those useful activities, of those fun activities, maybe you're not back doing sports or hobbies or groups or whatever. And when you're not doing as much of that stuff, you have less opportunities actually for achievement, you're doing something productive, less opportunities for fun, and also less opportunities for feeling good about yourself. And so it kind of can become a bit of a cycle, because when you're not doing as much stuff, you don't get that opportunity for positive feedback from the world. And so that can have a bit of a cyclical effect on your self-esteem. And so one of the points that I make when I talk about the inactivity trap with people is that it's a little bit like going to the gym, pre-COVID times, I suppose, but we can't always wait to have the mood or the energy or the motivation to go to the gym, because if we keep not going to the gym, then we'll kind of feel more lethargic and we'll never feel like going to the gym. So sometimes we actually need to think about doing things so that we have the opportunity to get re-energized. So I don't know if that makes sense, but it's a nice way to think about how we need to kind of get back into activities to get our energy back. You can also reframe this, though, in terms of burnout, because one of the things I do see in some of the survivors I work with is that you can actually get so busy trying to get back into life that actually you can almost get a bit burnt out, because you feel the pressure to sort of really be getting back into everything and sort of catching up all at once. And, I think there's the idea of needing to catch up at school or uni or work, and catch up with your friends and catch up with your social life. And so that can lead to a bit of pressure as well. So it's important just to kind of, maybe just do a mental check of where am I with my energy levels, where am I with my activities, and how's that linking with my mood, my anxiety, my stress. So in terms of, what to do about this, I think the first thing is just kind of checking in with yourself and thinking about if either of those ideas, the inactivity trap or the burnout trap, relate to where you're at, or if you feel like you've got a pretty good balance. The other thing is really, and I think Megan as an exercise physiologist will be across this, but just to put in a plug for exercise. Really, I don't know if everyone will know this, but it's actually a nationally endorsed kind of sort of almost treatment these days, that we kind of say exercise is really important throughout cancer care, and especially in survivorship as well. And from a psychological perspective, we know that there's so much evidence for exercise for mood and for anxiety. It's sort of often as good as the medications itself. So it's really worth thinking about, can I treat exercise almost as a medicine to fit in my routine, whatever that looks like. And also just being kind to yourself. One day is different to the next day, and thinking about what can I fit in today that's gonna give me a little bit of opportunity for energy and positive feedback. I'm conscious of the time, but I wanted to touch on this idea of isolation. We can feel incredibly isolated after cancer treatment's finished, and I think there's that idea of abandonment and the idea of kind of being set loose. And that can feel incredibly isolating to people. And one thing that I often talk to people about is this idea that you can feel isolated in a way that you could be surrounded by people, surrounded by friends or family or loved ones or colleagues at work, and still feel really alone. So I think that's a tricky concept, and I think that kind of ties in with this idea of the social isolation of getting cancer when you're young, because it's not part of the usual life script to get cancer when you're, 16 or 26 or 36. It's just not. And so that means it's not what you were expecting, and you kind of are still figuring out your way to deal with it. And it also means your friends probably haven't really come across many people besides you that had cancer, and that can mean they actually really have a hard time knowing how to be around you or how to talk about it and things like that. So that can all feel really isolating. And I think one of the other things that I talk to people about a lot is that, there can be that sort of sense of being lost in your own body. And so some people will talk about this idea of you're feeling a little bit like your body let you down or betrayed you in some way, because my body was supposed to be all young and healthy and fit, and then it, this thing went and happened. And there's also the kind of sense of being lost in terms of the future. So career, what am I doing there? What does it all mean? And certainly a lot of young people will talk about this idea of sort of survivor guilt and survivor pressure. So there's the idea of feeling a bit guilty. So you might have met people or just known of people who maybe didn't do so well with their cancer treatment, maybe didn't survive, and there can be a pressure of why did things turn out that way? There can also be a pressure of, gosh, okay, I've been able to go into remission, so I really ought to do something pretty meaningful and inspirational with my life now. And that can be a lot of pressure, to feel like you almost have, deserved or earned the miracle sort of treatment, and the fact that you were able to, your disease was able to go into remission. So those things can feel really challenging. And I think that the social isolation can be one of the things that hurts the most and the hardest to deal with as a young person, because you're in this time of your life where it's kind of all about the relationship. So whether you've got a significant relationship in a partner or a spouse or a boyfriend or girlfriend, or close friendships, or just with your family, if you're not feeling connected with them, that can really sort of shake your identity, I think, and certainly your self-esteem. So one of the things that I really try and support people around is, building up the courage to have tricky conversations when there are things hanging in there or elephants in the room that you feel like you're needing to talk to people about. Maybe certain really good friends who, might have sort of ghosted away when you went through cancer treatment, or things, with how a partner might be kind of, experiencing or talking with you about. And so one of the really kind of simple strategies that I talk to people about is thinking about this thing called the I statement, which is going to sound so simple when I explain it, but it's about thinking about how can you put a tricky thing that you want to say in the context of your feelings about it. Because I think often when we're bringing up tricky topics, it can feel really confronting, and if it's about something that someone else is not doing the way you want them to, it can feel a bit like we can worry that we're kind of going to offend them or things like that. So the I statement is basically about putting your feelings out there and kind of owning your feelings, kind of saying, well, I feel kind of upset when this thing happens because blah. So, I feel a bit left out when, you don't tell me about stuff that you're doing with the rest of the girls. I know that you're probably trying to be really considerate, but I do feel a bit left out. Next time, could we do this? So things like that. But I think it's worth thinking about other things that I'm holding back because I'm worried what people are going to say or how they're going to react. The other thing I just want to acknowledge, because it's such a common thing, is the what ifs that can come up after treatment's finished. As Megan and Gab have beautifully highlighted, fear of cancer recurrence is really common for young adults, and the data suggests that it's actually worse for young adults than it is for older patients. I think there are lots of good reasons for that. And I think from a psychological perspective, you're fearing for your life. It's a worry about a threat to your life. And so that's going to put you in quite a fight or flight state in terms of, being ready to fight off a threat. And those kind of what if thoughts that are going to keep popping up, and the ones that tend to pop up at 3 a.m. in the morning. And from a behavioural perspective, that tends to get people doing a lot of checking. So for some people, that's a lot of bodily checking. So checking lymph nodes, or just scanning their body, checking their body, or reassurance seeking from a doctor or a medical team to kind of say, oh, is everything okay? And so that's a really common thing that comes up. These are some more quotes here just to kind of highlight with some of the young adults that we've worked with, this idea that it's a relentless thought that can really, it's quite a sticky thought. So it's a thought that can hang around and not want to go away. And that's a really common experience. And it's also exhausting. And I think in this year, perhaps more than any other year, we've all got so much on our plates that's exhausting with COVID-19 and all the impacts on maybe your job or your work or your family or anything like that. And then there's what if the cancer comes back? And so there's this feeling of just total overwhelm and just feeling exhausted by that. So, I wanted to give you a couple of really sort of small pointers about, the worry about the cancer coming back. And some of this is, things that you might have spoken about with your cancer teams, but maybe not. So it's asking that question of what can I control right now? And so that could be about your day. That could be, is there any actual, cancer-related information that I need to get. Like, do I need to sort out a scan? Am I behind for a follow-up? Is there anything that I actually need to sort out? So what's in my control and what's not? What can I give myself permission to take off my plate today? Being really kind to yourself around anniversaries, diagnosis anniversaries, also scanxiety, as Gab mentioned, just knowing and acknowledging that that's going to be a bad day or a bad week, and that's okay. And then the idea of activities, I think Megan touched on this really beautifully, which is this idea that doing things can actually get ourselves out of our heads and into the right now. And not everyone's into mindfulness sort of meditations, but I like to talk about even just kind of activity-based incidental mindfulness. So think about anything that's going to connect you with your five senses. So, it can be washing up. So it can be like washing the dishes in the kitchen sink, listening to the clank of the plates or feeling the warm water or noticing the bubbles. It can be having a shower and smelling, the nice smell of the shampoo. It can be anything quite simple, going for a walk and feeling the breeze on your face or kind of noticing the cars drive by. Anything that's going to connect you into the right now is going to be a helpful reprieve from all of the stuff going through your head. And it is really also just okay to have those thoughts. But I think the question is when they are kind of really taking over is that you want to be able to have spaces, to make space to do other things. And really doing what matters as well. So I think one of the things that's really valuable after cancer treatment is to think about what's important to me right now. And I think as Gab and as Megan have said, it can really focus you on what's important in life and what's meaningful to you. And I think when you're doing what matters, then I think that can give you something really valuable to kind of focus your mind and your attention and your emotions on. And that can help balance out the anxieties of the what ifs. So, it can be what's valuable to me in my friendships, what's valuable to me in terms of how I spend my time, my leisure time, my recreation time, communities that I really care about, that kind of thing. Being a psychologist, I really wanted to just have a point to say here, like, how do you know if you need a bit more help? You might have come across a psychologist during your treatment. Maybe you didn't. Maybe you've never met a psychologist before. But here are some things to think about if, as a guide, if you might benefit from a bit more help. So are thoughts or worries about cancer interrupting my flow of activities or preoccupying my mind for much of the day? Am I enjoying the things I used to enjoy a lot less? The stuff that I used to like is just not doing it for me anymore, feeling a bit flat about it. Am I struggling to get back to the things I want or need to be doing? Am I having trouble connecting with the people close to me or talking to them about the things on my mind? Or do I just feel like it would help me to sort out some of my thoughts and feelings about everything that I've just been through? So if that's you, one of the options to consider is that we have been partnering with the Cancer Council New South Wales for a really exciting program called Reclaim Life, specifically designed for young adults who've finished cancer treatment, really to do this exact thing, to actually address the challenges and the unique experiences of getting back to life after treatment, but also to learn some, really useful coping strategies to deal with it all. And so this is Reclaim Life here, and if anyone is interested to be involved, you can call the Cancer Council New South Wales, and this will probably all be in the resources as well. But it's really a useful way, if you kind of have never met anyone similar to your age who's been through it, it's a useful way to kind of dip your toe in that space, and also to explore just different ways of dealing with the realities of, life after cancer, or life, beyond cancer treatment. So what it is, just give you an overview, is for young adults aged 25 to 40 after treatment's finished, and it's small groups, 3 to 6 people, a video conference like Zoom, which I don't think I need to explain to anyone after COVID-19. We're probably all doing a lot of them at the moment, but it's led by a counsellor, someone like Gab on the team, and it's sort of 6 weekly sessions just talking about stuff like this, stuff like life after cancer and what are some useful ways that you can tackle it all. There's a workbook that goes along as well. So I really want to thank you all for your time and love to make space for a few questions as well, because I know that talking to each other and hearing each other's perspectives is so valuable. But I will say really happy, if anyone wants to follow up on anything I've said or reach out, I'm, more than welcome to reach out separately and have a chat.
Thank you very, very much. And just as a side note, all the links that are mentioned throughout the presentations are in that resource sheet. I do want to give a special mention to the Cancer Council online community, but also Canteen has a great online community as well. COVID has really emphasised how amazing these online communities can be. So within the resource sheet, there's also the Cancer Council online community, but for the under 25 years, but also their parents can utilise things like Canteen. So feel free to check them out as well. I'm just going to pop over to some of the questions. So I really appreciate the amazing questions that have come through the registration. I think they've really captured the a really big group of questions that have come together, so I tried to make sure that everything was covered. But if not, if you have questions outside of this, you can call that 13 11 20 number, 9 to 5, and they will do their best to answer the questions that you may have after the webinar. So I might start with the first one, which is cancer is a really scary word. It often isn't associated with survival. Are there any tips in how and when to share your cancer history with a prospective partner? So I'll let you guys take the floor with that one, give your perspective. Gab or Ursula or Megan, either one.
Yeah, I'll start with something. What I thought about is understanding it yourself. I think before you try and talk to someone else and explain to somebody else what's happening, what you, how you want to explain your cancer experience. So pay attention to that. And there's huge value in practicing these sort of things out loud before you try and talk to somebody else.
Yeah, that's fantastic advice. I had a bit of a think about this as well. You know, I think one of the things that I would probably suggest is that it's okay to normalize it in the conversation that it is kind of really full on, because it was probably pretty full on for you going through it as well, and it wasn't what you were expecting in your life, and so, you know, you can kind of relate to them on that level that, gosh, this is pretty full on, like, and, you know, for someone to get when they're 29 or whatever. So I think that's the first thing, to kind of put them at ease. And I actually kind of think that it can be really useful sometimes, just as a really practical strategy when you're having tricky conversations, to sort of be doing something at the same time, like maybe be driving somewhere, or like, I don't know, like baking some sourdough together, or, you know, making some pancakes, or I don't know, whatever it is, but like doing something with your hands, or like going somewhere, walking, driving, because it gives you that space, like physical space, but also emotional space, to kind of be keeping yourselves busy while you're talking. And I think that can be really valuable, particularly for a partner or, you know, someone you're on a date with. That, you know, it is big news potentially, so you want to give them a moment to kind of clock it and process it, and, you know, and you kind of want to allow there to be some of those moments of silence, and that's a lot easier to do when you're like driving or on a bushwalk or something. So that's just like a thing that I always think can be handy. I think if I can just say one more thing, what I would say is I would feel free to tell them what you want from them or don't want from them. So if you have a thing about people, you know, pitting you, or like seeing you as a victim, or saying, oh, I'm so sorry, that must have been awful, or, you know, whatever it is, everyone has their thing. But feel free to say, look, you know, this, you know, happened, and like I'd love for you to just like to you know, still treat me the same way, or I'd love for you to kind of talk about it this way, or do this. I think that people really appreciate being told what to do and what not to do, or how to support you, like with specifics.
I think that leads perfectly into the next one. And I love this next question. And Megan, I might actually ask you to give your perspective on things that you found were really helpful from the professionals that you were dealing with when you were going through your treatment, but also in survivorship. So what's kind of been the key things that have helped you in that whole part of your life? Trying not to say journey.
It's like a loaded question. There's so many things. Really just, I think I might have mentioned it, is just making plans. for the future, and not really focusing on the now and the really bad times, but focusing on when times are going to be better. I think that when Ursula mentioned about burnout, I think I probably experienced that a little bit, and then I kind of came to a bit of an equilibrium. But yeah, just had lots of plans to catch up with friends, family. I had a newborn nephew, so I really, lived to see him on most days because I wasn't working at the time, and just surrounding myself with people, watching trashy TV, enjoying good food, and just enjoying the time off, really, as well. Once it was all
it's amazing the joys that babies can bring into your life. They're just so gorgeous. Ursula or Gab, did you have anything you wanted to add to that question?
About health professionals?
Yeah.
Not really. I mean, I think every young person's different, really. So I think the best thing that I can do is help a young person feel a bit more like themselves. And so, so I think it's about just connecting with them. And I really like it when, the young adults I work with, tell me how they prefer to work and talk and stuff like that. So
thank you.
To get back to life.
Okay, so with the next one, we talk about, as a young woman living with cancer, how do I deal with the social isolation of my peers who were all in that young family phase of their life? And I think that's kind of been touched quite beautifully by everyone throughout the night. But did you want to add anything more to that question? Gab?
Yeah, I think it's important to acknowledge that the way your life is different to how you imagined it, and that there are certain situations that you will be separate from, such as having a family. But try different things. I say, focus on who you are and what you can do, and start to explore different options for you. So if it doesn't work for you, that you don't want to hang around with your friends that have all the kids and everything because that's not happening for you, just really go out and create something different and explore some options. Yeah.
Yeah, I mean, this question I found really interesting because, I know a lot of people with small kids as well, and I think one of the things is that I think people in that phase of their life generally, there's generally a disconnect, I think, between when people start to have kids and families and then the people that are, maybe just single or partnered adults but that don't have kids. And I think that's a social kind of divide that can just happen during that phase of life anyway. So I wasn't quite sure whether this was coming from the emotional perspective of the grief of potentially they have all these kids and I maybe am not going to be able to have kids, or I don't have kids right now, or even just the practical elements of they're so busy with the kids and I really want support and there's no one around. But I actually ended up coming to a point of thinking that either way, I think that I would probably think about who are your closest people, and maybe just think about, is there anyone that you feel brave enough actually to just express this to and to say, hey, I miss you, and is there a way that we can actually just connect one-on-one without the kids? And, I think many people would actually respond really well to that, especially, they're probably really dying to get away from the kids at some points, to be totally honest. And that, not that it's a test, but I think sometimes how people respond to things like that can really also help show their true colors as well. Your true friends will really often stand up at that point when you say, I need you, I need some support, I need your love. And the other thing is also just thinking about a bit trickier in COVID times, but think about who are you and what are your values and what's important to you, and are there ways that you can actually start to explore your identity in different circles and spheres now. Not that you're replacing your friends, but just to explore new communities and, open yourself up for new connections with maybe people who aren't in that family phase of life as well.
I think one of the things that we've kind of spoken about, even just leading up to this webinar as well, even when we were in the beginning discussions, was this age group, they're not as aware of the impact that cancer can have on an individual because they haven't been exposed to it very much. So it may just be a matter of just being honest and being open with people who you feel comfortable with, like you said, because people in that 25 to 40, they may not have been around cancer very much unless it was a bit older or their parents or their grandparents. So being able to have those really amazing conversations can wake people up to, oh, I didn't even think of that, or I didn't think that would be something you were going through. The last question here we've got is how to manage that fear of passing away early, being newly married and 7 months pregnant, finding out they're expecting. She's now got this fear, or they've now got this fear that they will pass away early and leave the son and husband behind, which is quite a loaded one, again, but common.
Yeah. Do you want to go first, Gab? Or I can.
No, you go this time.
Okay.
Thanks.
Sure. I really felt for the person asking this question, and I guess I wanted to normalise this in the context of being human, because I think that as humans, often it happens in the moments of our lives where we are experiencing fulfillment or joy or excitement or anticipation, that fear of death and death anxiety does rear its head. You can think about it like the sort of cruel or tricky flip side to loving something or someone, that you suddenly have the fear of, oh no, what if it goes away? What if this ends? And so I guess I wanted to normalize that from the perspective that this is a normal human thing to have, but it's especially acute when you've been through cancer, because you've had that additional thing of like, oh yeah, and my body can actually do this when I'm 30 or whatever. So I think it's really hard. So it's quite common to have like worries about that when, for people generally, when they're pregnant or having kids. And so I guess I wanted to also put this in the context of the fact that right now I'm guessing you're very sleep deprived, 7 months pregnant, and quite, hormonal. And that's not to explain it away, but just to kind of put it in the context that that's also going to make it so much harder to be dealing with this anxiety. So I guess it's totally normal to have those thoughts and worries, but I would really encourage this person, consider whether you might have space to go get some help for that, because there's really good evidence-based therapies that can help with, fear of cancer recurrence and also death anxiety and stuff like that. And now might be a good time when you've still got a couple of months before bub comes. And because we know that prenatal and perinatal anxiety is also really common, and it doesn't get talked about as much as postnatal depression, but it's really common. So I think, it might be a nice time to think about getting some help for that, but really understandable though.
Gab or Megan, did you want to add anything to that?
No, I think Ursula said it perfectly. Okay. Megan?
Okay, so thank you for all of your information and insight, and just tapping into that knowledge and experience has been so amazing, so thank you very much. I just want to remind about just some support and information that is out there and available. So we've got that Cancer Council 13 11 20 number. It is a national service, Monday to Friday, 9 till 5. The online community, which we're all getting so much more accustomed to the online space right now. And there are some amazing forums, blogs, support groups. There's a specific forum for those living with and beyond cancer for you to just download as much as you want, and there's the support there waiting on the other end of the keyboard. There's also Lifeline. So if anything is niggling at you, you feel like you want to have a chat with somebody, and anything's kind of, you just want to get it out now, there's that 13 11 14 number, and please feel free to give it a call. I just want to remind you all about the exit survey. It will go automatically to the survey after this webinar in a couple of seconds. And please feel free to give as much feedback as you like. It is anonymous. I'm not going to be too deterred by anything. I really appreciate it. The link and the recording will be available in the next few days, or beginning of next week, with the resources and everything like that. I want to say a big thank you so much to Gab, Megan and Ursula. It's been such an amazing webinar, and I really appreciate you taking the time out of your night, storm and all, on a Thursday. I really very much appreciate that. And to Laura, thank you so much for moderating our chat for us. You make life so much easier for me, so thank you very much, and I'm sure that the audience really appreciates you as well. And also a special mention to Dry July, because Dry July is the reason we're able to do webinars like this tonight. So thank you, Dry July. And I hope you all have a really amazing night and take care. Thank you.